Are you sure? Are you ready to talk about this?
Not really, but I think it's important that we talk about it.
I agree. It is important. We had a health scare. This actually started 2 years ago back in Ecuador, and we knew some stuff was brewing when we came to do our health screenings. That's one of the reasons we came to KL. If you guys missed our previous video, we talked about this, but we did not talk about this specific issue in that video because we were still going through and processing everything.
Yeah, and I think I want to talk about the healthcare stuff first, Amelia. I got to warm up before we talk about this.
Okay.
So a lot of you have been voicing concerns in our last video about healthcare, and if you move abroad, how do you handle healthcare? And is it affordable? Is it high quality? Is it as good as the U.S.? And I think that we should talk about that first because there's a major reason why we're here instead of the U.S. dealing with some major health issues.
All right, well, I think we should start by talking about how the systems work outside of the U.S. In every country that we've been to, every country has a public and a private health system, and they are both extremely affordable, and they are good quality. Almost all the expats use the private healthcare system, and that's what we did in Ecuador, although we know people who use the public system too. And I gotta tell you, it is completely different than anything you're used to using in the United States because you don't have to deal with all the bureaucracy around going to the doctor.
Yeah, it's a lot more streamlined and efficient. When you have a free public system or mostly free, the private system has to compete with that. And so they do compete by offering a higher level of service, but at a competitive price, because if they overcharge, then everybody will just use the free public system. But what we found is that the prices are extremely competitive in other countries, and the quality is just as good, if not better, in a lot of instances outside the U.S. It's completely night and day different.
To us, one of the most important things is being able to see a doctor and get the follow-up care that we need right away. I mean, a big draw to coming to Kuala Lumpur was to do those health screenings and take advantage of the fact that you can go to a hospital and get all of your stuff taken care of within a few hours. We talked about this in a lot of detail in our last video, but the bottom line is we were able to come in, get the health screenings done, identify things that needed follow-up, and take care of them very quickly. And I know that that is something that does not happen easily in the United States, but it does in basically the rest of the world, especially if you're not using the public system.
Yeah, a lot of people just self-pay on their insurance. That's what we're doing here in Kuala Lumpur because our insurance in Ecuador does not cover like routine health stuff. And some of my things were pre-existing conditions. If I wanted to have that covered by insurance, we'd have to go back to Ecuador, but that's a lot of airplane time and thousands of dollars in airplane tickets, and we aren't ready to go back yet. So we just decided it was just cheaper and easier just to pay out of pocket here in Kuala Lumpur.
And a lot of you have asked about health insurance too. I get questions about recommendations for international plans, and I do not recommend that you use those. You can get travel insurance to get you to your new home country. If you're planning on staying in a country long term, definitely get private health insurance in that country because it is a lot more affordable than any of those international plans. And they come with their own coverage, like our Ecuador coverage is for emergencies, but it covers us all over the world.
So what else do we want to talk about on this, Amelia? It's so much different. I mean, we've had a lot of health stuff between the two of us since we've been here in Kuala Lumpur. We came for the screenings, which were $462 each for each of us. But we had a bunch of other things come up, and they were real things. It wasn't like the hospital trying to gouge us or scare us. They were largely pre-existing, except for Amelia's osteoporosis. That was a new one we weren't prepared for.
No.
Everything that I had looked at here was a pre-existing condition. We knew it was there. It wasn't like they said anything that really surprised us.
No, and also we could see all the test results.
Yeah.
I found like it gave me a huge sense of relief and a peace of mind knowing what's going on and that I can go ahead and take care of myself better moving forward, which is now what I'm doing. But I think the whole takeaway in us talking about this briefly in this video is just to give you guys some peace of mind when you're thinking about moving to another country. And I know it can seem really overwhelming when you're thinking about healthcare costs and health insurance, but it is so much easier compared to the US because you can get in to see a doctor quickly. You can self-pay and expect to pay significantly less. I'm talking like 60%, 70% less than prices in the US. So you can make that work for you.
Yeah, even like we had insurance, health insurance, a high deductible plan in the US, and all the things that we've had done here. And we're going to go through this in this video and share the things that we've had done and the cost associated with them. Everything together was like 40% less than our deductible in the United States. So we would have still been paying out of pocket for all of this stuff, even with health insurance back in the US. And here we're able to get it all taken care of. We've been here 2.5 months and we've done like 2 years worth of healthcare in US time in 2.5 months here.
That's a really good way to put it.
It's unbelievable, the difference. All right, so I think it's time. I need to talk about this. I don't want to. So 2 years ago, we found out I had an issue with my prostate. It was too big, and there were lesions on it that were revealed after a PSA test and a contrast MRI in Ecuador. It was in monitor mode. They were too small to do a biopsy, and last year they were bigger, still too small to do a biopsy. The prostate was bigger. So I knew I had an issue, and I was supposed to go a few months ago for another MRI, but we waited until we got here, and I'm glad we did. However, the lesions were big now.
Yeah, in retrospect, we should not have waited.
In retrospect, we shouldn't have waited because the lesions were big and the urologist was very concerned and the prostate was even bigger than it was last year. The first thing they did after they tested my PSA and it was high, and with the pre-existing thing, they ordered the contrast MRI again. And for this, we went to Gleneagles. The urologist that I'm working with works out of both Prince Court and Gleneagles, and both of those hospitals are highly recommended for private care. Gleneagles is known to be more affordable. Prince Court is like where the foreign dignitaries go for their health care. At least that's what the Malaysians tell us in the comments of that other video. So the contrast MRI on my prostate at Gleneagles was $706, which is more than I paid in Ecuador. It's about $400 in Ecuador for the same thing. However, it was a full-size MRI, and I wasn't like this the whole time.
Yeah, unfortunately, we don't have a picture of the MRI in Ecuador to show you.
It was like a child-size MRI. I barely fit in it. My shoulders were like crunched together. Here it was a full-size MRI. And they also gave me some sort of a shot that made it so the lower part of my body did not move at all during the procedure. And they did another thing, which makes me realize how humiliating healthcare can be when I have this cute little 25-year-old woman telling me, relax, it's not going in.
Moon River. Whew. Thank you, Doc.
They put an air tube in to make sure I didn't move at all. It was, man, I don't like talking about this, Amelia. The contrast MRI revealed that everything was worse and I needed to have a biopsy. We arrived at the hospital at 6 a.m. and we went to Gleneagles for this because that's where the urologist said that they had the robotic device to do the biopsy. And we got checked into the hospital and I put the robe on and all that stuff. And then I met with the anesthesiologist and my doctor came in and talked to me, and 8 o'clock they rolled me out and into the operating room. And I was still awake for that. And so I remember the OR. It looked like any OR I've seen before. They all looked pretty much the same. Wasn't anything special. But after that, I don't remember anything.
Well, I guess that's a good thing. So they took me out to the waiting room, and so the way it works when you get checked into Gleneagles is that you get a patient number. So that's how I tracked JP's progress, because in the waiting area, they put the patient ID number and the status of whether he's in surgery or post-op, or if it was completely done. They put that up on the board. They don't come out and talk to you. It's not as dramatic as the TV shows. So I was able to see where he was and then go back to his room to wait for him. And he was back a little after 10 o'clock.
Yeah, so I was gone for 2 hours. Basically, it's a procedure. Between the procedure, they said that took a little over an hour for the procedure. And then it was another hour in recovery because I have issues with anesthesia.
Your recovery was a lot longer than that.
Well, I was in the recovery in the OR area for an hour. But then we came back and I don't remember anything for hours because of the anesthesia. I just don't wake up from it. And then when I do wake up, I'm sick and throwing up. And so we had to deal with a lot of issues. So we ended up not leaving the hospital until 4 p.m. So we were there for 10 hours and it was on a Saturday. And so we didn't have, the lab was closed by the time they were done. And so we didn't get the results until
Wednesday morning.
They thought they were going to have them by Tuesday, but we didn't get them till Wednesday. So we're waiting this whole time to find out if I have cancer or not. And to end the suspense, I do not have cancer. It was a huge relief. I hadn't slept for days worrying about this. It all just became way too real for me when the doctor was going over like how bad it had gotten, and he was really concerned. And I asked him, like, how long can I wait to get the biopsies? Like, you need to do it soon. What the diagnosis is, and we'll tell you the cost here in a minute. The diagnosis is fibroglandular hyperplasia, which is a form of benign prostatic hyperplasia. And basically it just means I grow fibrous growth in there, which is not nice. Why does my body do this to me, Amelia?
Well, I'm just glad it's not cancer.
Yeah, they're treating it with antibiotics and medication, and hopefully, and I'm going to come back here in like 4 months and get a follow-up and have it checked again. The first doctor's appointment when I met the urologist at Prince Court was $35 to see a specialist, a urologist, and he talked to me for a long time about this. We were in there for almost an hour. And then we had the follow-up appointment at Glen Eagles on Thursday to get the results, and it was $20 to get these results. $20 for a specialist doctor appointment.
That was a lot easier visit, though.
Yeah, it was more fun.
Yeah, we had good news.
Yeah, and so the biopsy itself, now this is a robotic procedure, full anesthesia, operating room, all of this stuff. It was $4,125. And that was a bit more than we were expecting. He told us it would be between $3,000 and $4,000. Even that was a bit more than I expected it to be. We looked up online, in some countries it's cheaper, probably not in the U.S., but it is in other countries. And so it was a bit pricey.
But it still made sense as opposed to buying plane tickets to go back and get it covered in Ecuador under our insurance.
Yeah, and if it had been cancer, we would have gone back to Ecuador so that our insurance would have covered the treatment for that, because it was diagnosed in Ecuador, so I still have the same insurance and it would have been covered under that.
Yes, but boy, not that I don't want to go back to Ecuador, but that's not when or why I want to go back to Ecuador.
Yeah, so thank goodness it's not cancer and it's treatable.
Yes.
I mean, Amelia was in tears the other day when we got the news, and
yes, it
was emotional. This has been so emotional, both of us. It was just the waiting and not knowing, and it was rough.
It was rough.
All right, so now Amelia's going to talk about her osteoporosis update. She doesn't have much of an update, but we did want to share the costs for that.
No, I don't really have much of an update at all because I have to wait and go back and get another DEXA scan when they can go and see if I have any improvement with my bones. But I am taking it very seriously. I have been doing more resistance training and
working on those guns.
Yes. And working on eating more protein because that's important. And but with the doctor, my doctor visit with my specialist with the endocrinologist was $45, and then she prescribed me 6 months of medication, which included some hefty doses of vitamin D and calcium and some other stuff. And that total cost for all of that was $360. I'm pretty pleased, but I can't really tell you guys anything because
we don't know yet.
We don't know.
Before we talk about my experience with a cardiologist and the costs associated with that and my coronary CT angiography with contrast, that's a mouthful. We wanted to let you know that we're going to extend the discount on our Move Abroad Express e-course for a while longer.
If you want to move abroad for a higher quality of life and a lower cost of living, then you definitely want to check out our course.
Yeah, this course walks you through every step of the process so that you can move abroad with a lot more confidence and a lot less doubt.
We've been living abroad for 7 years, and we have learned a lot during that time, and we put all of that information in the course to make it much easier and faster for you to start your new life abroad.
And there's a lot of money-saving tips in there as well. We made some really costly mistakes when we left the United States and moved to Ecuador, and we put all those in there so that you can avoid them, and they'll probably save you more than the cost of this e-course, which is already steeply discounted.
Just scan this QR code here to lock in your discount now, or go to ameliaandjp.com/MAE. All right, JP, it's time to talk about the heart stuff.
Yeah. So this is another pre-existing condition that I have. I was diagnosed with high cholesterol over 20 years ago. I was in my early 30s. And so we've known that this has been an issue for a long time. So we went, and it was higher here than it has been in years, largely, I think, because of all the palm oil that they use and everything that they cook here when we eat out. And it's palm oil will raise your cholesterol level. So I think that had a bearing on it. But so we met with the cardiologist. That appointment was $67 to meet with him, which was more expensive than the other ones. I was surprised by that. And then I had the coronary CT angiography with contrast. That was $763. And I'm curious, like, have you guys had this done in the U.S. or anywhere else? Actually, just share that in the comments. I'm really curious, like, what does that cost? That's where they do the scan of your heart with the contrast and just to see if there's any blockage.
And these were both done at Prince Court.
Yeah, they were.
The cardiologist and the CT scan.
Yeah, so the scan revealed a minor blockage in my left coronary artery. So that means I now have mild coronary artery disease to add to my list of ailments.
Yeah, but you don't have cancer.
I don't have cancer, and I don't have to have anything done on my heart. Now I got something else in monitor mode. He did put me on a cholesterol medication, which I was resistant to, but they have some new ones now. It's actually working really well. I've already had my follow-up. My numbers are all well below in the normal range, so I don't have to worry about that now. And the only side effects is it makes me a little drowsy.
Yeah, which isn't bad since you take it before bed.
Yeah.
So that works out really well.
Yeah, I'm not going to say the name. I'm not going to give free advertising to a big pharma company. And it may not work the same for you. Everybody's different. All right, so then the next issue that we had is I injured myself. I'm not sure if it was from falling or what, but I injured my neck after we got here. And now I've got issues with shoulder pain and numbness in this arm and this hand. And so we went to see a neurologist. And what the cool thing was, I just went to the front desk at Prince Court and said, I need to see a neurologist. I have a pre-existing spinal condition. And can you get me an appointment? And she typed away at her computer. And I had an appointment a couple hours later with a neurologist. It took me months to see my neurologist back in Denver. I got it the same day.
Yeah, that was crazy. It was the afternoon, too.
I know. It's the afternoon. We just went and had like lunch at the hospital and then went to the appointment. It was crazy. So one of the reasons we left the United States, if you're new to our channel, is that I had 2 major spinal surgeries, and we call that the year of health now. And it was bad. Recovery was a year, was horrible. And so I've got this pre-existing condition, and so I told the neurologist that, and she ordered a regular MRI on my neck, which now I have 2 bulging discs on my neck, which is causing this pain. And so she recommended physical therapy, which I went to, and I also went to acupuncture. So that's some of the costs of this. A neurosurgeon appointment, not a neurologist, neurosurgeon, was $45. My neurosurgeon in Denver it was $300 for an office visit. And because I had a high deductible, it's all out of pocket. The MRI was $398 for this MRI of my neck and upper back.
And didn't we actually pay a little extra because we were...
It was $100 extra because I wanted to get in immediately. Otherwise, I would have had to wait like 5 days.
It was a week, yeah.
It was a week because they were booked up. But by paying $100 extra, they basically added another appointment on to the end of the day. So I went the next day instead of like the next week for an extra $100. So it would have been $298.
Yeah, and just to point out why we had to rush it, because somebody kept putting it off.
Yeah, I put it off for like 6 weeks, and it got so bad, I just said, we had to go. So the physical therapy appointments, she prescribed 3 per week, and those were $58, which were kind of expensive. I went for a couple of weeks and felt like I wasn't getting anything out of it. And I'm just doing the physical therapy, the exercises at home. I also saw an acupuncturist a few times. That was $28 per session, which is not bad. And I actually felt like that he helped more than the physical therapy did.
Yeah.
Yeah.
It was really good.
Yeah. So the doctor said that the goal here is to avoid surgery as long as possible, that at some point I'm going to have those fixed. Whether it's a laminectomy or a disc replacement is yet to be seen.
I was just thinking as you're going through and listing all this stuff that we've really been through a lot here.
I'm pretty sure that I grew up next to a chemical dump site or a nuclear reactor or something, or just got really bad genes, because it's one thing after another. I just don't have a very good body. And I told Amelia, if I could upload my consciousness to an anatomically correct robot, I would do it without hesitation. And the robot would have hair.
I was just thinking, would you be like Terminator?
Yeah, the Terminator. I'll be back. I don't know. It's very frustrating. And sometimes I feel like it's just my body's like that. The car at the end of the Blues Brothers. And I'm not that old. I'm only 53, and I've had most of these health issues all of my life. I've had a lot of these issues for 20, 30 years, and it's really frustrating.
Well, I'm just glad we took the time to do this. I mean, sometimes it's better. I know some of you said that you'd rather not know, and I get that too. Sometimes it's nice just to not know, but had we not known, we would have had all this stuff, the what ifs all the time, and now you know and you can manage it better.
Well, and like with heart disease, a lot of times if you don't know, by the time you do know, it's too late. You're dead. I mean, heart disease is the #1 killer, and most people only have one episode, and that's it. And I don't want to leave Amelia.
No, I don't want you.
We have a great life. I'm really happy. I'm a lucky man to have such an amazing wife and woman in my life, and I don't want to be done with it. And if it takes going to the doctor and getting checkups and stuff, that's what I'm going to do.
I'm glad to hear that.
Yeah.
Same here. All right. Well, did we miss anything?
I don't think so. I guess if you guys have experience with any of these procedures, drop them in the comments along with where you had it done, city and state or country, and how much it costs, and also how long it took you to get in, because I was able to do most of these things within a day or two. Yeah. The only thing I had to pay extra for was that MRI on my neck.
I want to just reiterate with all of you out there, if you're nervous about what healthcare is like outside of the U.S., please try not to be. We've gone through a lot here in Malaysia. We've dealt with health issues in Ecuador. We know a lot of people who have had similar experiences to us all over the world. The healthcare around the world is good, and you will be okay.
Yes, that's a really good way to wrap this up, Amelia, because it's true. A lot of people really worry. They worry if they can afford it or if it will be a good quality. We can assure you it is, and it is affordable.
Yes. Now, if you have Medicare or you have a chronic health condition, that's a different situation. But so many people are able to go and have these experiences of a lifetime and travel or move abroad and still take good care of themselves.
Yeah, and I have a lot of health issues, and we're not going to stay at home in the United States just to get them treated. We're out living our lives because life is short, and the year of hell in 2015 taught us that the life is short and you never know when it's going to end, and tomorrow is not guaranteed, and all those cliches, blah, blah, blah. But it's true. It's absolutely true. And we're out here living our life despite my health issues, and we're going to keep doing it.
Yes, we are.
All right, guys, remember to check out the Move Abroad Express e-course. We created that especially for you to help you do what we're doing.
And if you like this video, leave us a thumbs up, please, and we will see you all next time.
Ciao.
Ciao.